Hello, and thanks for tuning in to this presentation of Straight to the Heart, an exploration of crisis theory. This presentation was researched and compiled by Lauren Lewis, Sheridan Rowling, Heather Warzcinsky, and Renee Lounsbury. In this presentation, we're going to introduce what crisis theory is, primary practice principles, appropriate practice settings to implement crisis theory, and the strengths and limitations. Before we jump into crisis theory interventions, let's review what a crisis is. According to Langer and Leitz, a crisis is an event that leads to a temporary state of psychological inability to function as one ordinarily might. Crisis theory can be utilized with individuals in a psychological emergency where they are defenseless and incapable of caring for themselves, and also with people who are simply so overwhelmed by an event or circumstance that they lack the ability to cope appropriately. It's a short-term treatment option and varies based on the situation, but the goal of any crisis intervention option is to restore the individual back to a healthy baseline. Crises present both a challenge to cope with the situation the best way possible and an opportunity to learn new skills or recognize skills already in place. There are four main principles of crisis theory. 1, it's time-limited and short-term. 2, engagement and assessment occur simultaneously and efficiently. 3, it meets concrete and emotional needs through the provision of services. And 4, it must move quickly, seeking to help a client return to previous levels of functioning. These four principles are all essential and interwoven throughout the stages of crisis intervention. It's the short-term focus of the intervention that prompts assessment and engagement to happen concurrently. Empathizing, using active listening skills, and doing a quick non-biased assessment of the situation will allow the social worker to connect with the client while also helping them develop solutions and goals. Seeing the problem through the client's perspective supports the third principle of meeting emotional needs and promotes the efficiency highlighted in the fourth principle. The main premise of these principles can be summed up in one statement: straight to the heart. They all focus on speed and efficiency in developing rapport, engaging with the client, and assessing the situation in an effort to get to the heart of the matter, which is finding a healthy solution. The goal is for the clients to get to a place where they can see the crisis from a more objective perspective, develop healthy coping techniques, and decrease or end the interruption to their lives. Crisis theory presents a form of intervention that allows the client to rely on the social worker for support for a limited time period. Through services which focus on the resilience and strengths of the client to return to baseline, social workers can help individuals learn from the crisis and how to manage similar events in the future. Crisis can happen on different levels, ranging from low stress to high stress. According to Roberts and Oddens, there is a 7-step model that can help crisis intervention teams work towards resolution with a client. As you're looking at this diagram, you'll notice the model represents a bottom-up approach. The first thing you'll do is conduct a biopsychosocial, then quickly move up to making psychological contact with the client and gaining a collaborative relationship or building rapport. You will then identify major problems and find any events that triggered the crisis, and then allow the client to explore their emotions and feelings surrounding the event, after which you will search for and plan new coping strategies. This step can be challenging as the mental health practitioner will be relying on the individual in crisis being able to rationally help develop an appropriate plan. Once these new coping strategies are discovered, an action plan can be developed and the client can attempt to implement it. This is where the crisis becomes resolved. The client is able to process their feelings, develop coping strategies, and implement them to cope with the crisis. The last step is to follow up with the client and help to coordinate more long-term support as needed. So what are some situations or settings where we could use crisis theory? Many social workers work in crisis-oriented agencies such as 24/7 crisis lines, natural disaster relief, or domestic violence shelters. But crisis is not limited to those settings, as it's an inevitable part of the human experience. As a social worker, it's very likely that you'll work with clients who have experienced a crisis in the past or will experience one while they are in services with you. It's imperative for all social workers to be familiar with crisis theory in any setting so that they will have the ability to assist a client if a crisis occurs. Scenarios. These next few slides, we're going to go over some crisis intervention examples. So in this slide, we see an in-depth crisis scenario where a crisis team implements the 7-step model we reviewed previously. I urge you to pause this video and follow the crisis team along as they work with the client, after which we'll go over a few more examples where crisis theory can be used. There are many other scenarios where crisis theory can be implemented. These include harm to self situations where someone discloses their intent to hurt or kill themselves. It could be something like witnessing a traumatic event like a shooting. It can involve sudden legal issues like deportation or incarceration, or being rejected by family due to coming out. Crisis theory can be applied in diverse settings, and it's important to keep certain factors in mind in order to make crisis intervention effective in different scenarios with people of different cultures or backgrounds. It's important to remember that crises can occur in various forms. Cultural competence should be emphasized with crisis intervention, as what may not seem like a crisis to one person can be a huge detrimental crisis to another. Different intervention techniques should be used to meet the client's needs based on what they report and based on their specific situation, and various factors of their situation should be considered as the client is going through their crisis. Strengths and limitations of crisis theory. Crisis theory is very critical work and has many strengths. It promotes a client-centered approach by incorporating active listening and developing plans collaboratively. It has great compatibility with other traditional theories of counseling and psychology, making it easy for professionals of different approaches to be able to implement crisis intervention. Crisis theory is easy to use and is time limited, which makes it easy to transition clients to more long-term care in a different setting during follow-up. Despite these strengths, there are some limitations to the theory. It can be challenging to measure the effectiveness of a model used because of its short-term aspect. Each professional is going to have a different approach to a client's case due to having unique understandings of the crisis, which creates uncertainty about the effectiveness of each intervention. Another difficulty with the short-term aspect of the approach is that longitudinal studies cannot be done to show effectiveness of the intervention over time. Additionally, the way crisis interventions are implemented can be fragmented and bureaucratic. So in conclusion, crisis theory is a time-limited form of intervention that allows the client to rely on the social worker for support in order to return to a normal level of functioning. It can be used in almost any social work setting and can be tailored to be effective with people of many different backgrounds and cultures. It can be hard to measure for effectiveness, but very easy to apply in high-pressure situations, which is necessary in a crisis. Thanks for tuning in, and if you are interested in any of the resources we used, please feel free to take a look at these references.